This is my sealant video. So first we're gonna start off with patient prep. We're gonna place the glasses on the patient, along with asking the patient if they're okay, and checking the occlusion of the tooth as well. Okay. Once checking the occlusion, you will then clean the tooth with the pumice and the prophy brush. Once the tooth is clean, you're going to use your air and water syringe and your saliva ejector to remove all the cleans. Okay. Once the tooth is rinsed and dried, you're going to use 2 cotton rolls and a dry angle to isolate the tooth from preventing any saliva to getting within the tooth. Then once again, you're going to dry off the tooth before placing the ectant. I'm going to place the ectant on the tooth. We're going to let that sit for about 20 seconds. After you let that sit, you're going to grab your air and water again and your high suction and remove all of that. Once that's removed, you're going to dry off the tooth once again. Once the tooth is completely dry, this is when you can apply your sealant. You're going to apply your sealant in all of your pits and fissures. And along with that, you're going to use your micro brush if you apply too much sealant, and to spread the sealant as well. Once the sealant is applied, you're going to use your curing light and cure the tooth for 30 seconds to a minute. Okay, once the tooth is cured, you're going to check the occlusion with the Explorer. If the occlusion is hardened, then you did it right. After that, you're going to floss in between the interproximals to make sure the sealant did not go in between the teeth. After flossing, you're going to grab your articulating paper and ask the patient to chomp, chew, grind their teeth to make sure that their occlusion is flat, along with the sealant as well. And that's all.